So good morning, good afternoon, good evening, wherever you are, and welcome to this last session of the Technet webinar series on deploying an electronic LMIS, making the right choice. Before we start, I would like to welcome our guests who are going to discuss what's the right solution for you in terms of ELMIS tools. Today, we have with us three panelists: Chris Wright, who's a consultant, Grevendonk from WHO HQ, sorry, and Austine Omiunu from UNDP Malawi. We'll start with Grevendonk, who will discuss the role of ELMIS in the context of the Immunization Agenda 2030. Then Chris Wright will present the core functionality of an ELMIS and three case scenarios. In addition, we have a presentation, a country presentation. We'll finish this session with questions and answers. You can ask your questions during the presentation in the Q&A box or in the chat box. They will be answered by the panelists after the presentation. As usual, this session is recorded and we'll share the links to the video as well as the slides by email and on the Technet website. This session today is a wrap-up of the webinar series, which started with an introduction, the title of which was You Want to Deploy an ELMIS, Now What? We had 7 companies introducing their tools with country cases. We had M-Supply, Bilita, Field Supply, Logistimo, Medexis, OpenLMIS, and DHIS2, who introduced us to the last mile ELMIS module. All the materials, the videos, the slides, and more details are available on the Technet website. You can see the URL. We'll share the URL by email and on the platform. But we start, before Jan starts, I'd like to briefly introduce Technet 21 to those who are not familiar with the platform. So Technet was established by WHO and UNICEF in 1989. We are a global network of immunization professionals, and we are committed to strengthening immunization services by building relationships, sharing knowledge, and coordinating activities. Our goal is to improve immunization services by bringing together immunization professionals at every level, global, regional, national, subnational, in every country in the world, and from every sector, private, public sector, and so on. The network has two complementary parts. We hold a Technet conference every 2 years with immunization supply chain professionals from around the world, and there's a Technet website, the technet-21.org website that you can join for free at any time. It's very easy to join. We support also the community on Telegram. We have various channels. The most perhaps important, or the most important ones for you would be the main communities in French and English. We have an announcement channel in English, and we have an immunization supply chain channel in English, and I'll share the links with you by email later tomorrow or on Monday. I'm finished, so Jan, the floor is yours.
Yeah, thank you very much, Alex. So before we actually go into the presentation, I thought we do a little quiz, and I'm going to use a Multimeter for that. So if I can just take the screen.
Sure.
Yeah, done. Right, so we're going to use Multimeter for that. I don't know if you have used it already, but it's a very easy system that you can use for a quick quiz. So the way it works, you either open a browser on your phone or on your PC or on your laptop, and you go to www.menti.com and you enter this code 36791699. Or if you have your phone ready and want to do it like that, you can also take a picture of this QR code. So I'll do it right now as well. You can take a picture of that QR code and then open the same link in menti.com, right? So I'm going to put this screen away, but you will still see this code, so it will always work. And the first thing we would like to ask you, like, remember, like, people who paid close attention, you notice that the question is what kind of LMIS do I want, right? So what LMIS fits my needs? And then my question to you is, well, what are your needs? So first of all, what are some of the key challenges in your country or in your context that you have, that you see with your supply chain, and that you think an LMIS might be good for solving? And so somebody already replied, real time and simplicity. So I'm going to give that a few seconds. But the idea is that you just shoot some words, up to 3 words that you can shoot and say, okay, what is the challenge that you're trying to solve? All right, so we see information as the big one for now. Stockouts, integration, data for decision, visibility, accurate ordering, efficiency, data for decisions. So a lot of it is kind of actually turning around kind of this information and kind of visibility, probably ideally in real time, as we see there, on what's happening in the supply chain, right? So how much stock you have in the country, what maybe the issues are with temperature, with wastage, whatnot, right? We also see cold chain maintenance and obtaining real-time data. All right, so these were just a few first thoughts. Thank you for replying. So we'll do a next quiz, and the next question is, what benefits are you looking for when you select an LMIS? So let's say that you're looking at different options. So how would you weigh all these benefits of different eLMISs? Do you want it because it keeps stock at optimal levels, you create last mile stock visibility, etc., all the way down to remote temperature monitoring? So the question here is, I gave you a budget of 100 points, and you're going to allocate your points, like either 100 points on one or 20 here and 30 there, to each of these things, so that we can have a sense of what for you the most important benefits are of implementing an eLMIS. I'm also going to participate. All right, so this one is a little bit lengthier to reply, so only 5 people have answered so far, but for most of you, it seems to be about keeping stock at optimal levels in stores and facilities. Then creating that last mile stock visibility, improve availability of the vaccines, avoiding the stockouts, tracking lots and expiry dates to avoid wastage, manage a cold chain, integrate supply chain management across programs. That's also a theme we see a lot. And then finally, not so important probably for most of you, to manage warehouses and stores, right? But the stock levels at rational levels and the availability of vaccines together with last mile stock visibility, I guess, are the most important ones. And Chris will talk to that in a few slides from here. I got one last one, and just for you to kind of indicate which of these capabilities of an LMIS that you think or would consider crucial for any low and middle income country. So does it need to have an action-oriented dashboard? And you can say whether you strongly disagree or strongly agree, whether it needs that. Does it need to do lot tracking, barcode scanning, and whether it should be implementable on mobile devices? All right, and here the 2 kind of capabilities that we see coming out strongly are maybe, first of all, that it should be implementable on mobile devices, which makes sense because, you know, we need it to be rolled out in lower and middle income countries where you don't have necessarily computers at any desk, but also having that action-oriented dashboard is very important. And then lot tracking and barcode scanning, it's important for some people, but not everybody on the call. So thanks a lot for that quiz. That just gives us an idea about how you stand towards those capabilities. And I'm going to hand the presentation back to Alex. I think that you're driving the presentation. Yeah. And I'm going to introduce one more slide. So first of all, I thought it would be good to kind of frame the ELMIS and the supply chain actually within the Immunization Agenda 2030. So the Immunization Agenda 2030 is kind of this big plan, or let's say a vision, that countries and partners have aligned to actually improve the situation in immunization. And it's built around many different things. But just to keep it simple, what we really want to achieve with the Immunization Agenda are achieving, first of all, 3 impact goals. And can you give it a click so that we can see these indicators come up? Yeah. So first of all, these impact goals are about reducing mortality and leaving no one behind, and ensuring good health and well-being for everyone. So these kind of high-level goals, that are measurable in terms of lives saved, or elimination goals for measles and polio and whatnot. The fact that we should have less zero-dose children, specifically 50% less, or only half of the number of zero-dose children. So those that are never reached by vaccination programs by 2030. And then of course also reaching coverage targets globally. And within that, of course, there are things that need to happen for these kind of lofty goals to be achieved, right? So if we want to kind of find the zero-dose children, if we want to make sure that everybody has a chance on vaccination, we need to do a number of things. And actually these are grouped into 7 strategic priorities and actually 21 strategic priority objectives. And one of these 21 objectives is about supply chains, and the wording is there. So the wording is that we need to secure high quality supply chains for vaccines and related commodities, and effective vaccine management within the primary healthcare system supply. So it's a mouthful, but I think you're all supply chain people, so you understand the importance of supply chains for actually kind of reaching elimination goals and reaching those last unimmunized children and reaching coverage targets, right? And I think one last thing I will say about that is very interesting. At the global level, actually, how the success of supply chains will be measured is that we will ask countries through the JRF, so through the joint report form, we will ask countries to report on the proportion of facilities and months with full availability of DTP containing vaccine and measles containing vaccine, meaning that countries also need to be able to track that. They need to be able to know what the availability status is of vaccines at the service delivery level, which, to be honest, right now, not very many countries are able to do that, right? So we see that as an ambitious kind of, like, we call it a learning agenda over the decade. And we hope that by the end of the Immunization Agenda decade, so by 2030, a few more countries are able to do that and actually also manage that availability at the service delivery level. So we think that is really going to be crucial it's one of the crucial indicators around supply chain in terms of achieving the Immunization Agenda, let's say. Lots of words on the slides, but I'll leave it like that. And I'll also put in the chat box maybe the URL where you can find all these Immunization Agenda documents for later reference. And with that, I'll hand it over to Chris.
Thank you, Jan, and thank you to all of you who have been participating in this series, and to the suppliers of the ELMISs, who I know some of them are on the call. So I'd like to appreciate everybody for their involvement in this series of presentations. I think one of the things that we got back from in terms of questions is, what do we mean by functionality of an ELMIS? So, you know, what should an ELMIS be doing? And of course, the Menti poll gave us some sense of what that is. Well, a lot of it is about inventory management, making sure that we know that we have optimal supplies and no stockouts at the health facility level, and at the district stores above, which are normally the suppliers to the health facilities. So basically, there is a module on an ELMIS that functions like an electronic stock card or an electronic ledger. that piece of paper that shows the name of the product, the opening balance, the issuing of that or dispensing, the receipts of new, any losses, wastage, or transfers, and then of course the balance. And for some of the stock cards, they will also include the batch number and expiry date of that product. So the ELMIS is doing exactly that at the facility level in terms of inventory management. And then, of course, there's also the other core element that it usually takes place at the end of the month, or sometimes every other month for other products, but for vaccines, it's typically every month, where there's transactions. In other words, somebody is requisitioning or ordering new supplies, or else they're being allocated from the district store based on an informed push or some other decision-making process. Or to transfer supplies to another facility that might be low in stock, or that might be able to use up short shelf life products quickly. And of course, to confirm the receipt or the proof of delivery when supplies arrive at the health facility or at the district when we're talking about higher up the system. Transaction management should be able to, and can in most of the, I think all of these, the systems that were demonstrated, can suggest quantities based on different criteria, whether it be the maximum minimum inventory levels or an optimal stock level, that suggests to the user the amount that should be ordered or allocated, but also allows the user to override that based on their own knowledge of the situation. Perhaps there's some seasonalities going on, and or else there's going to be a big campaign in that area, and you need to order more. And of course, it enables somebody to review and approve the order or the allocation of that new resupply. So those are the core functionalities of any ELMIS that you're going to find. Next slide, please. Thank you. Now, there are other functionalities that an LMIS might do, and many of these are covered by the systems, the 7 systems that were demonstrated in these sessions. So they might manage dispensing to patients or issuing to wards or outreach workers at the health facility level. Dispensing to patients is different than issuing to wards or outreach, because to patients it's per unit, per tablet, per dose, whereas issuing to a ward or an outreach is per container, for instance. So per vial, if you will. They might support annual forecasting and supply planning at the national level. Now, these would be informing procurement decisions and budgeting decisions. And of course, supporting the procurement process of issuing tenders and managing supplier relationships, managing incoming and tracking where the consignment is in the supply chain outside of the country situation. Warehouse management at the national or the district, or sorry, the regional or state or zonal stores, depending on how the country determines that. Warehouse management includes things like put away, knowing exactly which shelf this particular batch of this particular antigen is sitting in which cold room, for example, and being able to quarantine new product coming in until they've been quality tested. So there's other elements of warehouse management that are more involved processes than you would typically find at a health facility or at a district store. Transport planning and management, so managing your fleet of vehicles, whether it be trucks or 4x4s or motorcycles or bicycles, but be able to determine what transportation you have, how much they can hold, whether they are refrigerated or not, and therefore need cold boxes. Managing your transport. Asset management, and this goes to the cold chain equipment maintenance, cold chain equipment remote temperature monitoring, but it can also be applied to diagnostic equipment and other medical equipment. So asset management is a broader term, and that includes managing, what unit, refrigeration or CECE unit, what brand is in which place, and how old is it? When was it last maintained or serviced? So asset management goes abroad, provides a broad array of services. Then there's the business intelligence. So that's what the data, that's kind of a bit of AI or however we want to program our dashboards, our decision support, like recommended quantities to order, for instance, our alerts that say this batch is expiring in the next month or so, and different scenarios. What would happen if we changed our buffer stock to something, if we lowered it or raised it? What would that do to our stock levels, and what can we do that, or can we add another antigen to our supply chain without worrying about storage capacity? So scenario modeling. And of course, there's also the possibility of having communication within an ELMIS app for feedback, supportive supervision, peer networking, where you can actually put out a question. I've got short shelf life or near to expiry DTP. Does anybody need some? Can it be used up before it expires? Can we transfer it, for example? So lots of different additional functionality. And these are all functionalities that each time a country is making a decision about what ELMIS to, or really any MIS to deploy, these are the questions that need to be answered of what do we want it to do? What functionality should an ELMIS have for our needs? And not just for our needs today, but for what we think we might need a year from now, 2 years from now, 5 years from now. In a lot of countries, maybe we can't reach the last mile today, but maybe we can plan for an ELMIS that will eventually reach the last mile when cellular networks are sufficient to get out there to the last mile. Or perhaps we are only doing urban areas because that's where the cell connections are, but we know that we eventually want to get out to the remote villages once there's cellular connections out there. So we really need to know what the functionality of an ELMIS, what sort of processes it's going to support, and that's the functionality, so that the right ELMIS can be selected and deployed. Next slide, please. So that's where the requirements come in. Looking at your entire supply chain processes, all the stuff that you do on paper right now, or that you do with Excel spreadsheets, and looking at every process and thinking to yourself, how can we digitize this? How can we support this in a digital system to make it easier, to make it more streamlined, to make the data more visible in your particular country situation, your particular program context? And that's looking at the entire supply chain, from planning to procuring to managing stock to delivering the service. And again, be strategic, considering what you need the ELMIS to do now and how it might grow to meet your needs over the next few years. Next slide, please. So let's look at scenarios. So for instance, your biggest issue is you need last mile stock monitoring. You don't really need warehouse management. You've got an ERP, or you've got a warehouse management system already in place, and it's doing fine. You're using Sage or Navision or Epicor, or some other system, and but you really have no visibility about what's happening at the last mile. And so in this situation, you're really focused on those two core areas of inventory management needs, as well as the ordering or the transactions from the supplying store, if it be the district or the region. And you don't really see a need to do anything else, because your ERP or your warehouse management system, you expect that to be doing just fine for the foreseeable future. But your biggest gap is here at the last mile, and that really you're focused on optimal inventory to monitor your stock. So that's one scenario, but let's go to another scenario. Next slide. In this case, we're going to integrate everything. And there's a number of countries that have been doing this. Ethiopia, for example, in which the ELAMAS is intended to work at the national level in the warehouse to manage all medical products, all medicines, all diagnostics, all vaccines, and all other requisite supplies. And then it's going to do it all the way down the chain. So from the central store to the regional stores, to the district stores, and down to not just the health facility, but perhaps even the health post. So now you're going to need a lot of different of those additional elements that the ELMS is going to support, especially in warehouse management, procurement support, forecasting, etc. And it needs to be beyond just vaccines and the cold chain. So now we're looking at asset management for diagnostic equipment, surgical equipment potentially, X-ray machines, etc. Next slide, please. And here we need, we're looking at perhaps just the vaccine supply chain, right? For simply immunization, but we want to have optimal stock levels at every level. And we want to use barcodes, and we want to be able to use the modeling so that we can say, okay, we think we're overstocked with buffer stock at the national and regional level, but we want more buffer stock at the district level. So what does that mean for our supply chain? And so we're going to be doing these analysis using the data from the entire system to be able to scenario plan and to say, okay, I think we can lower because our supply chain is trustworthy and reliable enough that we can lower our buffer stocks at the higher levels. We can have good sufficient buffer stock at the district, and we can even lower our buffer stock at the last mile. Because we have good visibility on what's going on, and we also can see what's going on with temperature monitoring. And so we can respond quickly if we see a problem that is putting stocks at risk at the last mile. So this is a different scenario from the other two. So I just wanted to present these different scenarios to give you an idea of how you might be thinking in terms of what your country needs are, what your program needs are, and how limited or expansive you would want to be in how you're considering your requirements for an ELMIS. Because these are all things that you really need to think about before you choose your ELMIS. And it's answers that the ELMIS supplier is going to need in order for them to help you configure the system to do what you want it to do. And at that point, I think we are going to turn this over to a real live country to talk about how they've gone through this process. So I'm going to turn this over to Austine, who's going to tell us about Malawi, where there are actually 3 different systems that are in place. And I think he'll address why they have moved the way they've moved. So Austine, over to you.
Thanks, Chris. Good afternoon, everyone. Good afternoon from Malawi. So I'm going to talk about the Electronic Health Information Network deployed in Malawi through the Ministry of Health by UNDP Malawi. And it's called the EHIN platform. And it's a pretty robust application developed by one of the software providers that was mentioned, which is Logistimo. And we have basically worked with the Logistimo team to customize this application to the Malawi context and basically to fill the gaps that we have seen in the Malawi logistics management information system. So I'll be sharing some of our experiences with you, where we are right now in Malawi, what our plans are for the future. Most importantly, I'll be sharing our critical success factors and the things that really helped us to move as far and as quickly as we have with this system in Malawi. Next slide, please. Just to give you a brief background, like every other government, the Malawi Ministry of Health has a mandate to make sure essential health services, including the provision of medicines and medical supplies, are available to Malawians. And this mandate is held by the Health Technical Support Services, which within it sits the pharmaceutical department of the Ministry of Health. They manage about 700 health facilities across the country and about 5,000 village clinics. And I'll explain in a bit why it's important we take note of the village clinics and how we define the last mile when we're talking about it in Malawi. Also, there's a very robust EPI program. This program has supported the COVID vaccine rollout and is basically responsible for all immunizations within the country. Basically, we need a system that could assist in evidence-based decision-making in Malawi, both for vaccines and for pharmaceuticals. So even though these products are managed by two different departments, we saw that there was an opportunity to leverage resources in the information system space by just creating different instances for the different types of products. We could have the same system functionalities, the same system capabilities available to both the vaccine management team and the pharmaceutical management team. Next slide, please. So just to give you a brief illustration, this is what we have when we talk about how we have segmented our supply chain spectrum in Malawi. We look at 6 basic functions. There is the part that looks at supplier management, warehousing, and distribution. This is managed by the Central Medical Stores Trust, the CMST, which is the government central warehouse for managing medicines and medical supplies. And their responsibility stops at the door of the facility. So everything to do with procurement, warehousing, and distribution, up to when these products get to the door of the facility, is the responsibility of the Central Medical Stores Trust. Now, when it gets to the facility has a responsibility of inventory management, which is basically stock management, and making sure the products are dispensed to patients. And when that is done, then they can report back to central level managers, and then evidence-based decisions can be taken on how to resupply the facility, on what is happening to the stock at the facility, and how to basically inform procurements at the central level, quantification and supply planning. Now, when we looked at this spectrum, there was a gap in our MIS system within the health facilities. We had not deployed any automated tools for facility stock management or dispensing. And this is where the Electronic Health Information Network came in. So for the upstream activities, components of the supply chain, we have the CMST Enterprise Resource Planning System, which is Microsoft Navision, that is deployed to manage that part. And then other functions, we have the OpenLMIS system, which the facilities use, the districts use to order from the CMST based on the monthly reports that are largely paper-based, that are sent to the district, and these reports are put into the OpenLMIS system, and then the CMST can access it, and based on that, resupply the facilities. And we have the C-Stock system, which you would find at village clinics. So in all of this, the challenges we had were, one, our data from the facility level had a lag, a 30-day lag. So you couldn't, by the time you're looking at the data and taking decisions on resupply, you are already about 30 days behind. And so we try to estimate by just looking at the consumption levels. We try to estimate to say, you know, we can estimate this consumption for another 30 days. But the reality is, more often than not, we are off with these calculations. And why estimate when we can actually know per second, per minute, per day, per week, any given time, what is happening at any health facility with our products. And so we deployed the Electronic Health Information Network, which is online, real time, and brings a lot of visibility into supplies management. Now, on the EHIN platform, we're not just looking at health facilities, but we look at what we call entities. And an entity is basically any location where a health worker and products, or patient, a health worker and products interact. So anywhere, any location in any health facility. And if you take this definition, you find that while you're talking about 700 health facilities in Malawi, you are actually looking at over 6,000 locations across the country where products, health workers, and patients interact. And where these transactions are happening, you want to have visibility into these places. Next slide. So currently, just to tell you how we went to our deployment, we initially started deployment in 3 districts in Malawi, which is Blantyre, Rumpi, and Nchisi, and for medicines, pharmaceuticals, basically. And in that phase, we covered 700 entities in these 3 districts. So within just these 3 districts, we had covered 700 data points, while in the past, this number 700 was for the entire country. We're looking at 680 to 700 health facilities in the entire country, and we found that this is what you would find in just 3 districts, and we have 28 districts. So we trained 1,000 health workers. And the next phase of deployment, due to the COVID pandemic, we quickly had to prepare the country for deploying the COVID vaccine, supporting the National Vaccine Deployment Plan. And so about 861 entities, more entities were trained. And these are vaccine management points across the country. And about 1,100 health workers were trained in this phase. And we're closing the year with our last phase where we're bringing online the remaining pharmacy locations in the health centers. There are about 600 of those, and we're targeting training about 1,300 health workers. This is to be completed by December of this year. Now, once we've completed training the pharmacies, then we start to go within each health facility to identify and train lower locations in the health facility where patients, health workers, and products basically interact. And when we're talking about the last mile, and why this is very important, for us, we actually have dispensing as a core functionality on our ELMIS, because in the past, when we talk about the last mile, the supply chain had basically focused on getting products to where they can be accessed by patients. And this is at the point where the health worker is responsible for these products, with the hope, and I would say the hope, that once it gets to these health workers, the health workers will ensure that it gets to the patients. And in many countries, Malawi being one of them, in recent times, we have experienced cases of medicines going missing, medicines disappearing from the system. And sometimes the prosecutions had led to health workers being responsible for these diversions. And so we think the supply chain needs to be designed in such a way that it has to ensure that the products get to the patient. It's not enough that it gets to the SDP, but the information systems need to evolve even further to the point that it gets to the patient. So in Malawi, I'll talk about this more during the future tense, the future, or we look into the future. We are looking at a situation where we are deploying patient-verified access to services. And this means that the patient actually has to verify for themselves electronically that they access this medication or they access this health service. And that closes the transaction and the accountability loop within health service delivery. Because for Malawi, pilferage and unaccounted for medicines is really a severe problem. Next slide. Now, talking about critical success factors, and Chris mentioned some of this in his presentation, it is very important for us to have a clear and detailed business process mapping. Not only does that tell you what you want your ELMIS to do, it also illuminates the other players you have in the ELMIS space, the areas they cover, For us, we came in late to the party. I think EHIN is the youngest of the ELMI solutions, though it is pretty robust and now arguably the most widespread or widely used, because we came into a space where a lot of the ELMI solutions could not deal with or were not going into, because it's very granular and very high number of transactions that you're trying to capture. And so you have to make sure your business process is properly mapped so that you can actually know where the gaps are, know where the opportunities to leverage resources with other ELMIS deployment organizations are, and take advantage of that. So in addition to that, there is strong political will. In Malawi, the head of the pharmaceutical department is actually a big and very strong champion of not just the EHIN platform, but the entire, the illustration I showed you earlier, the entire end-to-end tracking process agenda that Malawi has to make sure that they can track products all the way from the central store down to the patient. He has presented this agenda and the system to the senior management of the Ministry of Health, to Parliament, and is really a strong champion for it. So he's really canvassing political will for the system. And this is very, very important, because when we are trying to effect change, we have to ensure that we have the political will to run in the direction that we want to go in. In addition, the system was deployed to meet a specific need and to fill a gap. So it wasn't just deployed for the sake of automation, for the sake of digitization, because we have to take into consideration the fact how this affects the way health workers work. It is true that tools make health workers doing their jobs easier, but that doesn't happen immediately. It takes a while for the health worker to change the way they work, to change from a paper-based approach to doing the work you do to an electronic approach, and also to change from where you can do your work now and fill the records later to when you need to fill the records as you do your work. That's the only way we can have real-time visibility, where we can actually see the way the transactions are happening, the way the stocks are changing. It has to be as it goes. So we have to fill this, design the system or deploy to meet a specific need, to make sure it is customized to our situation, taking into consideration the challenges we may have with human resources, both in numbers and skill. Another thing that really worked for us is we were deploying the system at a time that digitization was on everybody's lips, and everybody was talking about digitization and the importance of digitization in every facet of governance: agriculture, justice, health, education. Until now, people are still talking about the importance of digitization as a tool for efficiency. And so this really helped our deployment. We rode that wave to be able to get access to the people, the decision makers, the people in e-governance, the Parliamentary Committee on Health, to basically get their buy-in and present to them how much this is an advantage to the country. Next slide, please. So while we did have these critical success factors, the deployment did not go without challenges. From the numbers you've seen, the kind of numbers of health workers we've trained, and we still have quite a few more to train. Availability of this staff for trainings, conflicting schedules, working with other donors, completing schedules, meeting their responsibilities within the health facilities was a bit of a challenge. We really had to make sure we're training about, on average, 2 people per health facility or per entity, excuse me, in a manner that allows them to rotate such that when one person is in training, another person is available to provide services and vice versa. So we're able to navigate this, but it was a bit of a challenge. And also, because the application is used on mobile phones, mobile phone penetration is more in any developing country in the world compared to laptops and other digital devices. And so we do use the application on the mobile phone. And so some health workers use their mobile phones, and for those that do not have, we provide mobile phones. And the security of these mobile phones can be a bit of a challenge. But I do know that majority of the health workers are sincere and they want to use these mobile phones for what it's meant for. And so beyond the mobile phones maybe getting missing or stolen, there's also just abuse where you use the data provided for entering supply data for other things, and people are browsing Facebook and chatting with their friends and watching videos and things like that. So we're working with the telecom companies, not so much to police, but just to let the health workers know. Sometimes we share reports of how the mobile phones are being used, just to let them know that we do have visibility into knowing the kind of websites and the kind of locations that, or kind of things you're using the mobile phones for. And that serves as a deterrent to most people. And then they use the mobile phones for what it's meant for. And in terms of mobile phones going missing, we have less than 0.1% of mobile phones that have been reported missing or stolen from health workers. We also had the challenge of rolling out this system at the peak of the COVID pandemic. There were limitations because we're training people all the way at the lower levels. And so virtual trainings were just not going to cut it for us. We had to have physical trainings. And so you have to train, if you're training 20 people, you have to have them in a room meant for 100 people. And we could not train more than that number per time. We did take, we're very strict with the COVID guidelines, the prevention and protection guidelines. And none of our trainees contacted the virus during the trainings. But it just meant we had to go really slow with the trainings when we could have been a little bit faster. Next slide. Now, in terms of the future, we are now focusing more on data use. Now that we have the system in over 2,000, close to 2,000 locations, and by the end of the year, over 2,000 locations, we are focusing on data use, which is training senior management on how to use the data. The application has a separate monitoring application for senior managers where they can actually, it's basically a dashboard on your phone, but an active dashboard where you can, drill down, query stuff, and then actually contact a particular health worker at a particular health facility, at a particular entity, and question what you're seeing in the system and ask if it's right or wrong, or it needs to be confirmed before you make your decision. And so we're trying to train more senior decision makers on this, to deploy dashboards, because dashboards, they kind of prompt health workers, they prompt managers to take action. And so they're very useful. We can tell people that there's an app on your phone that you can use. But when you have a screen somewhere right in front of you that flashes when things go wrong, you tend to respond. And so we are trying to also deploy these. And then going into next year, we would be now training people at the ward level, the village clinic level to use the application only in locations where these gaps exist. Next slide. Thank you very much.
Thank you, Austine. That was very interesting. We're going to take some questions. It's already 10 to 4 here in Geneva. Let's start with we don't have that many questions. So let's start with the first one. When implementing ELMIS, where the data will be stored? Is it at cloud or server? Is there a need to have a backup system to prevent data loss? Who would like to take this question?
I'll start, and then I'm going to hand it over to Austine to talk about how Malawi has taken on this challenge. So that's one of the requirements that you're going to need to decide is what is the national regulatory environment around data ownership and the use of cloud storage options. There are countries that have decided to trust the cloud, in which case the servers might be, they might be in the African setting, they might be sitting in Rwanda, for example, or they might be sitting in Kenya, or they might be sitting in Canada, or Switzerland, or Korea. But the big service providers, Microsoft, Amazon, et cetera, that have these cloud server environments and services, their business depends on a highly secure and a highly redundant system. And so their investments, hundreds of millions of dollars of investments into securing the data of their clients, dwarfs anything any country is going to be able to do with their server environment at the Ministry of Health or at the Central Medical Store. However, there are countries that absolutely insist on hosting the data internally. And it's understandable, especially when it's medical data. And oftentimes ministries don't discern the difference between patient data, which must be highly secure, and product data, where there's no personal information that's getting out there. It's just about the vaccine, where it is, what batch number it is, and so there's different elements that need to be considered. However, in making your requirements, you can determine whether you're hosting locally on a local server environment or whether the cloud hosting is okay. In either case, having redundancy, having backup systems is absolutely essential. The last thing you want is for some malign actor to come in and hack the system and destroy the database and not have anything backed up. And so backup systems, in case the power goes off or the broadband connection to that server environment goes down, you do want the backup in order to secure both the data as well as the ability of the system to continue functioning. One option would be, if you have to host it locally, you also have a contract with a cloud server so that you have off-site, out-of-country backup services if the regulations allow for that. But definitely you want backup. Austin, do you want to talk about how Malawi has done this?
Yeah, sure. I'll share a few things. You're absolutely right, Chris, about the first thing that you need to consider when you're talking about how to host or store your data is what is the government policy or regulation around the type of data that you are handling. And for the eHIN platform, this is stored on Amazon Web Services. First, let me state that we use the eHIN platform under a software as a service subscription. And most SaaS subscriptions will come with all these things already provided within. So the storage of your data, the backing up of your data, the assurance that your data is safe. And like Chris said, we do not handle patient data as yet. I talked about trying to migrate the system to a point where we are implementing patient verified access. And Malawi has a national ID system where all adults and everyone over 16 basically has an ID card with a unique identification number. Now, if we do deploy this system where they can actually use this ID to verify access to services, now this changes the nature and the shape of our data and the need for security. And it is most likely we'll now have to host the data in country, deploy that infrastructure, deploy the backup, and also manage the storage and backup ourselves. But until we get there, we are still free to host the data in the cloud under our software as a service subscription that we subscribe to.
And where is the data stored for OpenLMIS and Navision? Do you know?
For Navision, I think it's also on Amazon Web Services. For OpenLMIS, I'm really not sure.
Okay.
Great. Thank you. And another question, is there a roster of examples of independent technical partners available to low and middle income countries to assist the choice of an ELMIS provider?
Great question. And yes, there is. UNDP actually has a roster. And so you can contact your local UNDP office and ask them to help you access their roster, even if you're using another donor for the actual deployment. If you have Gavi money or Global Fund money, et cetera, UNDP can be a partner in getting you the expertise that you need. UNICEF also has a roster of people that they can tap into, particularly focused on the immunization supply chain, because that's really their greatest strength. And so I would reach out to those two. But also, if you have one of the, for instance, the USAID projects in your country, the PSM project, they would also be a good potential source for a third-party expert who could come in and help, depending on whether they have the budget, et cetera, of course. So those three are probably your best bet in terms of getting somebody. But you can also advertise if you have other funds available. You can advertise on Technet or on the IAPHL listserv, the International Association of Public Health Logisticians, IAPHL, or Technet, and Technet really, to advertise for a consultant. So you have a variety of options.
Indeed, thank you. Another question from Lenin. Thank you for sharing the experience from Malawi. That's a great work done. Congratulations, Austine and team. So some questions. How long does it take from the start to the beginning to the
operationalization?
Thank you very much. I was struggling with this one. Excuse my French. And what is the costing? What does the costing look like? What is the level of ownership from the country for deployment of this tool, and what language in the tool, English or local language? Thank you.
Austine, do you want to start, and then I'll add to it?
Yeah, sure. Thank you, Lenin, for the congratulations. We appreciate it. I'll start with the first question. How long does it take from the start to operationalize? What we did in Malawi that really shortened, and if you ask anyone that has deployed LMIS solutions, the scope we have covered in the time we've covered it, it's really, really quick. And the first thing was in selecting our ELMIS solution, we selected an application that was so robust and so well built that customization needs were very, very minimal. It already had a lot of the functionalities that we wanted in the way that we wanted it. And so customization was just to make it, suitable to our environment, which happened very quickly. And we were deploying during the COVID pandemic, which is also another barrier that we had to overcome. But so our target for the entire country is to bring online 6,000 entities and have about 11,500 health workers trained on this application. We started training in December of 2020. We started customization in August of 2020, completed customization in October, and started training in December of 2020. And now we're in November of 2021. We have deployed, or let me say by December of 2021, which is a year, we would have deployed the application in over about 2,300 locations and would have trained close to 5,000 health workers. So we are moving very quickly, but we do have some way to go. So how long it takes really depends on how well you map your business processes, the kind of application you select, and then how you've designed your rollout strategy.
Yeah, I'll jump in and add to that. Thank you, Austin. There's a difference between getting a system set up, installed on the server, configured to your situation, maybe some customized reports. That can actually happen very quickly within a month or two. But what takes the most time is the rollout, is getting it out into the field, training all of those people to actually use it. So if you're a country like Sao Tome and Principe, you've got 32 facilities, and so I know they're currently looking at an ELMIS, and so it's very, it can be done very, very quickly. If you're a country like India, it takes years, and so it really depends on your situation. But with all of these systems, if your requirements are specific enough, and you've collected all the data that you need to provide to a supplier who can then configure the system to function the way you need it, that can be quite quick and relatively low cost. Under $100,000 to get it set up, configured, installed, etc. It's the training and the hardware if you need to buy phones or tablets or laptops, SIM cards, data plans, etc. That's what's high cost, and that's what's going to take time depending on the size of your program or your country.
Thank you, guys. We're 3 minutes over time, and I don't know if we still have our interprets if we want to carry on for like a few minutes. We have a few questions, and I have actually a call right now. So if you want, we can go through the questions, but please as quickly as possible. And
sure.
We have our interprets. Thank you very much, Morgan and Maud. Great. So next question: how long to implement an ELMIS? Very approximately.
How long to implement? Well, I think we touched on that already. It really depends on the situation on hand. So, to get it down to the district level, if you have 50 districts, then how long does it take to train 50 or let's say 100 people, because you want 2 per district, on the system once it's set up, once it's tested? So I'd say give it a couple of months to set it up and test it, and then whatever your training rollout plan looks like, and however fast you can do that.
Excellent. Thank you.
So just to add to what Chris has said, the testing part, the user acceptance test part of preparation is very, very important. And
yes.
the results of this goes into, as part of your documentation, your set of documentation. It is very absolutely essential you have your user base segmented and then do a sample to carry out a user acceptance test. It is very, very important.
Yeah, basically what that's doing is testing whether the system is responding to your requirements as planned.
Can I also quickly jump in here? I think
sure.
there's a bit of a trade-off also, like often kind of if the system is very complex, but maybe also, maybe very complete, but also maybe complex to handle and learn, basically, then your training is going to take more time, etc. So as Austin said, selecting a very robust, easy to use app-based application that is basically as easy to use as any other, like iPhone application, is going to make training, of course, much easier. And I think, as Chris said, training is going to be the most important part initially, and I think the second most important part later is then the acceptability and whether people will actually comply, right? Will people really kind of enter all their transactions and send you the orders through the system, or will they just keep on doing it via paper-based systems as they're always used to do? So whatever can be done to get people on board and actually have them move to the system as quickly as possible is I think the next thing And there's strategies for that. Often, like, there's kind of a drop dead date and say, after this, like, no orders will be fulfilled if they don't come through the system, etc. Over.
Excellent, thank you. And we're taking a last question, so please, guys, if you can make it short for the answer. I know it's going to be difficult because the question might require more time. Do you have any lessons learned from your contexts on A, strengthening national and subnational accountability for using ELMIS data, B, integrating cold chain inventory, RTMD, into ELMIS? So RTMD, RTMD perhaps for the interprets as remote temperature monitoring devices.
Yes, so the data from remote temperature monitors has been integrated in a number of countries. I think India definitely, a number of different M-Supply supported countries. Nigeria is planning to do that. Tanzania has already done that to some degree. Ethiopia has done it to some degree. So that's already being done, and it really depends on what kind of devices and the manufacturer's devices that you're using, but it's certainly possible. What was the other part of the question?
Let me go back to it. Sorry.
Accountability, I think.
Yeah, integrating cold chain inventory, RTMD, into ELMIS. So lessons learned.
Yeah. The other one is really understanding what is it about cold chain management that you want to be able to do. It's fine. It's great to know where the different units are. That's basic inventory management of your CCE. But even better is the serviceability or the service data. When was the last time they had maintenance? Whether they're offline, why they're offline? What's the power situation with them? So the more insight, the deeper you go into cold chain management, the better you are to be able to take effective decisions and monitor these units. So that really comes back to your requirements. What exactly do you want to do, and what do you want the ELMIS to do in terms of your cold chain management?
Great, thank you very much. And I think now we have to wrap up. Thank you very much, Chris, Jan, Austine. That was excellent. Just to give a last announcement. This is the last session of this webinar series. It was great. We're providing all the information. I will send you everything by email. Everything is made public. The next webinar, there's a next webinar series, which is on temperature monitoring, keeping a cold chain cold. We'll explore the different technologies available for active temperature monitoring of your cold chain. We'll talk about 30-day temperature recorders and remote temperature monitoring devices. And we'll talk about future of temperature monitoring and what is on the horizon. These are the dates. The first session is on Thursday, the 11th, exactly next week at the same time. And the session will be, where are we with temperature monitoring of cold chain? Thank you very much. Thank you very much, Chris, for your hard work on helping organizing this series. Really appreciate. Thank you, Jan, as well, because you guys worked really hard on that. Thank you, Austine, for this session. Thank you very much, everybody, for participating. And we hope to see you next week on the next webinar series. Have a nice day, evening, everybody, and take care. Bye-bye.
Thank you, Alex.
Thank you. Bye.
Thanks, everybody. Bye-bye.